Korsakoff syndrome. Korsakoff syndrome is a chronic neuropsychiatric condition secondary to a severe thiamine deficiency and associated brain abnormalities. This disease is often connected to excessive alcohol abuse, but has the ability to affect individuals without an apparent misuse of alcohol. Korsakoff syndrome is relatively understudied and underdiagnosed. Memory loss and impaired executive functioning are key features of the disorder. Differential diagnoses may be necessary, and speech-language pathologists and related professions should be aware of the etiologies, symptoms, and prognoses that accompany the diagnosis of Korsakoff syndrome, in addition to the often crucial roles they play in treatment. Korsakoff syndrome results from a chronic and untreated Wernicke's encephalopathy of the brain. Both conditions are secondary to a deficiency in vitamin B1, otherwise known as thiamine. Prolonged and excessive alcohol misuse, self-neglect and malnutrition, prisoners of war, gastric cancer, and hyperemesis gravidarum, otherwise known as complication with pregnancy resulting in vomiting and severe dehydration, are all possible etiologies for these disorders. 10% of individuals living with dementia are reported to have an alcohol-induced dementia, but the exact prevalence rate of Korsakoff syndrome is difficult to measure. According to Eisenberg, Zeta, and colleagues, about 80% of these cases are either undetected or unreported. Early signs and symptoms of thiamine deficiency include loss of appetite, nausea and vomiting, fatigue and weakness, apathy, diplopia, otherwise known as double vision, insomnia, anxiety, difficulty concentrating, and memory loss. Later signs and symptoms of untreated thiamine deficiency result in oculomotor abnormalities, ataxia, global confusion, disorientation with time and place, hallucination and confabulation, onset of coma, and eventually death. Wernicke encephalopathy is an acute neuropsychiatric condition identified by Carl Wernicke in 1881. It is characterized by three major symptoms: altered mental status, ataxia, and ocular signs. This condition is reversible with an adequate dose of parenteral thiamine. In 1887, Sergei Korsakoff identified patients with polyneuropathies, characterized mostly by what he described as an amnestic disorder with confabulation in the absence of most other features. What Korsakoff described in his patients was later identified as the result of untreated chronic thiamine deficiency, or late-stage Wernicke encephalopathy. The deficiency in thiamine was not discovered in these disorders until the early 20th century, but both men made important observations regarding the neurological states of patients presenting with these conditions. Korsakoff syndrome has proven to be quite a difficult diagnosis to make. Thiamine deficiency is not the only factor to be considered, but a coinciding loss in brain tissue concentration is also necessary for an accurate diagnosis. Korsakoff syndrome is often not tested for in hospitals, adding to the severe underdiagnosis of the disease. Generalized hospital contact is the most common form of identification for patients presenting with Korsakoff syndrome. 1.5% of all patients examined post-mortem have neuropathological brain lesions characteristic of the syndrome, and 12.5% of alcoholics have the same lesions. Kopelman described Korsakoff syndrome as being generally characterized by a severe anterograde amnesia affecting all aspects of explicit memory. Spatial memory seems to be particularly affected in both coordinate and categorical object-to-location binding. The patient may have a vivid memory of the object being discussed, but will typically be unable to recall where he or she has seen or interacted with the object previously. Aldman explains that it has been demonstrated that Korsakoff syndrome patients displayed unconscious influence of spatial configurations in an object-to-location memory paradigm conducted by Morover and colleagues in 2008. The researchers concluded that despite the significant cognitive degeneration associated with Korsakoff syndrome, patients can maintain the ability to retrieve information implicitly. In addition to spatial memory specifically, context memory in general is compromised in patients with Korsakoff syndrome. Context memory is a vital component of episodic memory, referring to the recollection of the environment in which a memory was coded. This includes spatial context, temporal context, the source of information, and the destination. All of these areas require successful and appropriate binding of complex associations, which take place mainly in the medial temporal lobe of the brain. These aspects are crucial for the accurate recollection of memories and explain the typical presentation of memory loss in patients diagnosed with Korsakoff syndrome. Gopi and MacLeod published a study in 2009 in which they assessed destination memory by asking participants to tell facts and stories to pictures of celebrities and then to later recall which celebrity they told. They concluded that destination memory was compromised in normal aging, Alzheimer's disease, and Huntington's disease. The same presentation of memory loss and affected area of the brain are present in patients with Korsakoff syndrome. A major limitation with studies on Korsakoff syndrome is the unrelenting focus on the disorder's connection with alcohol abuse. Clinicians purposefully avoid the diagnosis of Korsakoff syndrome to protect the reputation of their ill patients. Instead, clinicians will take note of a thiamine-related encephalopathy to document the symptoms they observe, but once again, a true diagnosis goes unreported. Eisenberg, Grazeda, and fellow researchers recently published a systematic review in April 2016 examining the prevalence of Korsakoff syndrome in patients with cancer. The researchers identified 4 pathophysiological reasons for the development of Korsakoff syndrome in cancer patients: decreased availability of thiamine, secondary to malnutrition or malabsorption, accelerated use of thiamine by rapidly growing tumors, hypermetabolic states secondary to infections or steroids, and finally impaired function of thiamine-dependent enzymes due to hypomagnesemia or byproducts of chemotherapy. Korsakoff syndrome results in a global impairment of executive functioning, particularly with planning, updating, shifting, and inhibition. Although prospective memory has not been studied directly in patients with Korsakoff syndrome, Altgessen and colleagues suggest that because prospective memory relies on episodic memory, working memory, and other executive functions, it too is compromised. Prospective memory is an essential part of organizing everyday life. Prospective memory failure can impact professional and social relationships and even poses legitimate threats to individual safety. Speech-language pathologists can work on prospective memory with their patients using salient visual cues in regard to task-appropriate processing. An effective strategy to use in treatment would be appropriate variance and manipulation of visual and written cues' perceptual distinctiveness. To illustrate this to a patient with Korsakoff syndrome, the speech-language pathologist can present prospective target words in uppercase letters and ongoing task items in lowercase letters. Similarly, the clinician can also present prospective target words in red on a black background, while ongoing task words are printed in white. This activity focuses on implicit prospective memory, a strength in patients with Korsakoff syndrome, and inhibition skills. In therapy, it would be beneficial for patients with Korsakoff syndrome to retain and recall word pairs presented in different locations. In addition to the recall of the specific items listed, the patient must engage the spatial and temporal context of the situation in order to be successful. Landmark recognition may also prove to be helpful for patients with Korsakoff syndrome, as it is intended to invoke a more automatic or implicit response, according to Aldman and Associates. Sufficient drilling of these scenarios is also very important to include in treatment. Patients with Korsakoff syndrome show intact ability to acquire contextual information after repeated presentation, resulting in faster localization of a target in the environment. No significant difference was found between errorless learning and trial and error learning, giving the therapist some freedom in that sense. Korsakoff syndrome results in cognitive linguistic deficits that fall within the scope of practice for speech-language pathologists. Understanding and utilizing the different aspects of memory and knowing which areas of strength to engage are crucial components to successful treatment of patients diagnosed with Korsakoff syndrome. Additionally, it should be understood that Korsakoff syndrome may result from a variety of etiologies, and all patients should be regarded with respect and human compassion regardless of their individual etiology. This disease is understudied and sparsely documented accurately. Future research should address these issues so that more preventative action can be taken. Until then, speech-language pathologists must focus on helping patients diagnosed with Korsakoff syndrome to maintain and improve their executive functioning for as long as possible, but should be aware of the degenerative nature of the disease itself. References.